In breast augmentation, there are no rights or wrongs, there are only preferences. So whatever I'm going to tell you is my own preference. After many years of doing breast augmentation surgery, we as surgeons all develop our favorite techniques. And my favorite technique, or my preference, is to place a round, high-profile implant behind the breast tissue and in front of the chest muscle. And I insert it either through an incision at the areola or at the crease, which is just below the breast. And the incision that I make is always a zigzag or WW incision, because when you join the wound edges together, it forms an imperceptible or invisible scar. When a patient has breast augmentation surgery, they're one day going to take off their clothes and they don't want to see a brown scar or a red scar, which is a telltale giveaway that they had something done. Frequent questions from patients are, will there be any pain and how long is the recovery? The pain is actually very minimal because I don't touch the muscle and I don't cut the muscle, and that usually is the main cause of post-operative pain. As for recovery, patients need to go home with 2 little bottles and a drain that comes out from the breast area, and they keep it in for about 12 to 24 hours. They'll come back the next day, we'll remove these little drains, and then we'll put the patient into a special bra that helps to mold the chest into the desired shape. And literally, patients can go out and start working and doing things within 2 days. Another thing is that patients are always telling doctors, I want to have a cleavage, which means, can you bring the implant closer to the center of the chest? You should never do that. When you put an implant into a breast, that implant has to follow the direction of your nipple. If your nipple points this way or this way, the implants have to be centralized to the nipples. And then if you want to get a cleavage, you wear a push-up bra and push everything towards the center. But if not, it won't look natural. One thing to always bear in mind with breast augmentation is that there are complications and risks. You can get an infection, you could get bleeding immediately after the operation. And these are the immediate complications which you might encounter, but generally less than 2%. Long term, the implant is still a foreign material. It's made of medical grade silicone. And when you put that into the body can ultimately recognize that this doesn't belong to the body. And so it creates a little wall of scar tissue around the implant. Now that could take many years. It could take 10, 15, or even 20 years. But in many cases of patients with these implants, the breast can turn hard and become a little round like a tennis ball. And at that point, you need to go in and replace it with a newer model. Usually in the span of a lifetime for a plastic surgeon, we will only remove and replace an implant once. An average implant can last for anywhere between 15 to 20 years. So by the time you do a change for the patient, well, they're really going to be in their 70s and may not need a breast augmentation anymore. And with developing technology, these implants are able to feel softer and to be more integrated with the body, such that they really don't need to be removed, if not for 2 decades or more. If you're considering getting your breasts augmented, do your homework and research the doctors that you see. At the end of the day, it's going to be a personal relationship between you and your doctor. You have to understand what they're trying to tell you, maybe ask them for some before and after results so that you can compare and see whether this is the correct doctor for you. Other than that, it's really just a one-on-one interpersonal relationship. If you found this video interesting, please like and follow us on Instagram and Facebook.